I'm going to be showing you some assisted PNF stretching for the flexors of the hip and the extensors of the knee. When we are performing the PNF stretching, I'm going to show you two different variations. One is going to be contract relax, the second is going to be contract relax Agnus contract. For the contract relax, you are going to take the client into the stretch as far as they can. Once you can't go any farther, they will press into you. So if you are taking them into extension, they are going to flex their hip. Then they are going to relax and you will take them deeper into extension. By taking them into extension, you're going to be focusing on stretching the flexors. For the flexor stretch for the hip, the first stretch that I'm going to be showing you is a modification of the Thomas stretch. So what you will do is you will have the client sit with their butt at the edge of the table. So we'll come forward a little bit and lay back. In this position, what you will do is you will take one leg, place it on your chest, and you will take it into flexion. By taking it into flexion, this is going to give you some retroversion of the pelvis, it'll flatten out the spine, and it'll allow you to get deeper into a stretch on the opposite leg that you are working. So whatever leg is on the chest, the opposite leg is the leg that we are stretching. So for the Thomas stretch, we're going to be stretching the psoas, the rectus femoris, and I'm going to show you a modification where we're going to focus a little bit more on the quads and just play around a little bit with the ankles. So the basic stretch for the Thomas test is going to be you take your hand on the thigh, you're going to take them into extension, thus stretching out the flexors, and then you are going to give a couple taps, they will press up, and then after 4 to 7 seconds, give them another tap to signify that they're done, and you're going to take them into a deeper stretch. Another way that you can do this is by performing a contract relax Agnus contraction. So you're going to give a couple taps to let them know to push into you. Then they are going to relax and bring their leg down to the ground. So they are going to assist you in taking them into a deeper stretch. Now that's the basic Thomas stretch. What you can do to target the psoas a little bit more. The psoas is responsible for flexion, external rotation, and for adduction. So what we are going to do is we are going to reverse all of those movements. So what we want to do, you're going to place your hand over their thigh, then place your leg over their knee. You're going to wrap your ankle around their ankle. So you can use your hand, or if you want, you could also just use the hand to stabilize at the hip. So what we're going to do for this one is press down, then you are going to take the knee into flexion, and then you are going to medially rotate the leg by bringing your ankle out to the side. So this is going to target all of the fibers. And then from here, you're going to give a couple taps. So what I want you to do right now is you're going to lift your knee up, give me a little kick, and push into my ankle. And relax. And then you're going to go deeper. So you're going to go down, you're going to flex the quadriceps by kicking into their foot, and you're going to medially rotate their leg by bringing the ankle to the outside. Once you have performed that variation, then what we can do is have the client turn onto their stomach. That first stretch focused a lot on the hip and also the knee joint. This stretch over here, it's just going to focus on the extensors of the knee. So to stretch out the extensors of the knee, what we want to do is take the knee into flexion. What we're going to do for this one, you're going to place one hand on the sacrum to stabilize the pelvis. Then you are going to bring the knee towards the butt. For her, she doesn't really need this stretch, but if you do have a client who is limited, you'll take them as far as they can go. Then you'll give them a little tap, they'll kick into you for 4 to 7 seconds. And then give them another tap to let them know to relax, and you'll take them deeper into the stretch. And then if you want to perform this with a contract relax Agnus contraction, what you can do is take them into the stretch, give a little tap, they'll kick into you. And then another tap, relax, and bring your leg towards your butt. So they're going to assist you in stretching them. And that is how you perform some basic assisted PNF stretching on the flexors of the hip and the extensors of the knee.